Thank you so much for inviting me to come and talk today. And actually, the scene has been set absolutely beautifully for me to start. But I'm going to talk a little bit about how this discovery has affected patients and families. And just by way of introduction, I'm from a patient support group called Unique. And we've been going since 1984. I wasn't there in 1984, I should say. But one of the things we've seen has been that enormous advance in genetic and genomic testing. So back in 1984, scientists and clinicians were diagnosing genetic conditions by looking down the microscope. And you've heard from all of the speakers today how that's moved forwards. And that's been an enormous difference for patient families. So although Nikki talked about 40% of people getting a diagnosis and still more than half not getting a diagnosis, we've had an enormous increase in the diagnostic rate in the last few decades. And that's been really hugely appreciated by patients and families. So I'm going to talk a little bit more about what a diagnosis means to patients and families. But I think it's a really good time to acknowledge that there are lots of families who are still undiagnosed, even after the discovery of ReNU syndrome. Today is a day where we raise awareness of those families, and it's actually Undiagnosed Children's Day today. So I just wanted to give a shout out to all of those families that still have a child that's undiagnosed. And there is an organisation here in the UK that supports those families called Swan UK. And often families start off in Swan UK and then they get a diagnosis either through changes in clinical pathways, diagnostic pathways that Susie mentioned, or by new research discoveries like the ones we've heard about today. But essentially at Unique, we support all of those families that have those neurodevelopmental disorders that Stefan was talking about earlier. So most of our families have developmental delays or intellectual disabilities. Like most patient organizations, we're a tiny team, but we're really committed to trying to help patients and families. So here, this is a slide I often show because I think it's a really good depiction of that diagnostic odyssey that lots of patients and families with rare conditions have. So it takes a long time, and it's estimated that the average patient takes around 7 years to get to that final accurate diagnosis. And why is a diagnosis so important? Nikki talked about the article in the Sunday Times written by James Coney, who's the dad of Charlie, who received the diagnosis for ReNU syndrome after many years of waiting. And I think that experience is a really common one for patients and families we see at Unique. So it's bringing an end to that diagnostic odyssey, which has often involved multiple tests, lots and lots of different specialists and appointments, and just trying to find the reason why their child is not developing as they might expect. I think it's human nature to want an explanation for why your child isn't developing as you might expect. But also it's that whole bit that we've seen already today. And I think hopefully you'll see even more from some of the things that I will share, that finding a community, finding others who are in the same position so that you can access better information about the prognosis of your child, but just to be there, to form a community and share experiences and not feel alone. And we surveyed our families just last year, and one of the primary feelings that they reported was that this feeling of isolation that often comes when you are affected by rare conditions. The title of my talk is how ReNU syndrome families were affected by getting a diagnosis. And I thought I could tell you, but it's much better if you hear it from patients and families themselves. And so Nikki mentioned the really fantastic condition-specific support group, ReNU Syndrome United, which is based in the US and run by a really amazing, full of energy mum, Jessica. And I asked Jessica if she would record a video of what the diagnosis meant to her for me to share with you. But actually what she's done is she's recorded a video of many families' experience from all over the world.
This is Devin. We're in New York and we have been searching for answers for 13 years. Getting the diagnosis of ReNU has enabled us to form together with other parents to start an organization that aims to advance research and renew hope for others all over the world.
We're Diana's family. We've been waiting 7 years to know about the ReNU syndrome. We're living in Poland. Knowing the diagnosis, it's given us the opportunity to connect with other parents and gain from their experience.
G'day, I'm Simon, this is Sarah, and this is Abigail. We're from Adelaide, Australia, down under. Abby got a diagnosis when she was 16, and getting a diagnosis has been really important to us because it removed a lot of questions we had before the diagnosis, and also means we're now part of a global community, doesn't it, Abby? Huff, huff. Yeah!
Woo!
Bonjour, je vous présente Thibaut. Il a 13 ans et demi. Nous habitons en France, au Relecq-Kerhuon, dans le Finistère, au bord de la mer. Cela fait 12 ans que nous étions en attente et nous avons eu le verdict fin janvier 2025. Nous sommes très heureux de faire partie de cette grande famille.
Hi, I'm Lindsay. This is Lars. We're in Virginia in the United States. We received our ReNU diagnosis in March 2024, and it's been life-changing for our family. It's really sort of changed our identity from being undiagnosed to being part of this community, but we're just so grateful to no longer feel alone and to have this renewed hope.
Hi, I'm Elliot, and this is my little brother Samuel.
We're from the northeast of England, and we didn't get Samuel's diagnosis till just for his 3rd birthday.
For us, having a diagnosis just meant that we had answers and a newfound community that we could belong to.
Hello, this is Cameron, and he is 16 years old.
We live in Florida, and it took us over 15 years to get a diagnosis for Cameron of ReNU syndrome.
Having the diagnosis of ReNU syndrome means that we are no longer alone.
Can you say hi, Cameron?
Hi.
Ciao a tutti, io sono Imma, lei è Maya. Maya ha 11 anni, noi siamo di Milano, siamo italiani. Abbiamo ricevuto la diagnosi di sindrome di ReNU a marzo del 2025, quindi circa un mese fa. Sicuramente dopo tanti anni siamo contenti di aver ricevuto una diagnosi, perché questo sicuramente non ci fa sentire più soli e ci fa sentire parte di un gruppo, e sicuramente la ricerca ci aiuterà ad affrontare meglio il futuro. Ciao a tutti e un bacio da Maya. Manda un bacio con la mano, con la mano.
Hi, this is Parker. He's 13. He lives in Minnesota. He received his diagnosis when he was 12 and a half years old. And a diagnosis to us means hope for the future and community.
Ella es Dayana. Vivimos en Edinburgh, Texas. Tardamos 6 años en recibir este diagnóstico y ha sido una luz en nuestro camino de oscuridad. Gracias.
Hi everyone, this is James and we live in North Carolina.
We got his diagnosis when he was 22 months old, and for us it just brought a lot of clarity to the challenges we faced during his first 2 years of life, and also a lot of hope for the future.
Nice.
So this is Arabella, and we are located in Oxfordshire in the UK. We waited for 7 years for the diagnosis of ReNU, and what has it brought to us? So it's brought a family community of other people that have got the same diagnosis, also knowing what it is now and not just that there is something else. It's brought relief as well, and she's a happy, outgoing girl and loves, what do you love the most, Bo? Water? Your friends.
This is Sean. He is 10 years old, and we are from Houston, Texas. We have waited 9 years for a diagnosis, and the diagnosis of ReNU syndrome has given us a really awesome group of people to connect with and share experiences with.
Hi, this is Charlotte. We're located in Maryland in the USA. We waited 18 years, 6 months, and 3 days for our answer. Having a name for Charlotte's disorder means so much to us. We have a community. We're no longer alone. And now we know that it wasn't our fault. Thank you.
Hello, it's Mike and Corinna from Philadelphia, and this is Naomi. She's going to be 27 in a week or so, And what did the diagnosis mean for us?
It was a relief just to finally have some clarity on what happened. I mean, at this point, we're used to her. And it was also comforting for our sons to know that they're not carriers. But we are really thankful for all the work that went into it.
Looking forward to meeting people in the summer.
This is my sweet boy Bentley, and we are from Dayton, Ohio. We waited 3.5 years to finally get a diagnosis, and we were so excited to finally have an answer. This diagnosis gives us so much hope for the future, and we can't wait to see what is to come.
So I think that has explained it better than I could do. But I think, as Stefan said, this has been a really amazing discovery, partly from the science, which is exciting, but I think this whole bit of the community coming together. And one of the things that we've been doing with the families and also the scientists and clinicians have been to run these webinars. So it's been an amazing opportunity for parents and carers to actually have direct access to those people who discovered the ReNU syndrome. So the first one we did was, you can see some familiar faces here, Nikki and Stefan, did a webinar for around 70 families around the world. We've subsequently done a couple of more webinars with other researchers and clinicians who are located in different parts of the world. And actually the third one we did in January was with a team of French scientists and clinicians, and we ran that in French because I think it's really important to make sure that this information is accessible for as many people as possible wherever they are in the world. The other thing we've been working towards is getting really good quality information that is understandable for patients and families, so that when they get that diagnosis, not only do they get that lab report that Susie talked about with the diagnosis, but you get signposted. You get signposted to the support groups like ReNU Syndrome Reunited that I've just mentioned in the US, but you also get a package of information that you can take home and understand what this condition is, what it means for your child now, and what it might mean in the future. And we put together this information guide. Nikki and Stefan helped us write it. We always do these guides in collaboration with the experts in the particular disorder. And also the patients and families. So with ReNU Syndrome United as well. So you can see there's pictures. Inside the guide, there are quotes, and there's also all of the medical information that we know so far. And of course, as more and more people get diagnosed, we'll learn more and more about this condition, and the leaflet will get updated. We also have a picture book for children. And again, this was written in collaboration actually with a number of the families, but also the siblings. So the picture book is often really useful for siblings to try to understand why their sibling has the condition they have and how it might affect them. And actually we have at the conference that's coming up in New York in the summer, one of the siblings, Jessica's other child, her daughter, will be reading this picture book aloud as part of the conference program. So information is so important. And awareness is really important. So making the whole world aware that this condition has been discovered and what it means to patients and families to get this diagnosis. So I've just shared a couple of them. Here's the story that Nikki talked about from James Coney, and it's a really fantastic article in the Sunday Times. Again, talks about what the diagnosis meant for him and his family, and particularly he speaks really articulately about the lifting of that guilt and the fact that it's so important for parents to know that it was not their fault. I've included this quote from Lindsay, who was one of the parents on the video you just saw, that she said on a podcast that was run by Genomics England. And she says, so this feeling that we've been on this deserted island for 8 years, and now all of a sudden you're sort of looking around through the branches of the trees. It's like, wait a minute, there are other people on this island. And in this case, actually a lot more people on this island. Yes, it's exciting, it's validating. And again, I think that just really reiterates that feeling of community that families feel when they get a diagnosis and can connect with others. And I'm sharing this picture that Nikki shared earlier just to show, I think it's really important to remember that these families are all over the world. These conditions can happen to anybody, wherever you are, whatever your ethnic background or socioeconomic group. And so we are starting to see diagnoses from everywhere. And these are the members of ReNU Syndrome United. Although, as Nikki said, we really need to think about how we can expand diagnosis so other countries where they don't have Genomics England and other really fantastic clinical and diagnostic pathways to access testing. And again, I just wanted to highlight this conference that's coming up in New York. And a quick plug for Unique. So we cover lots and lots of different developmental disorders. And of course, what we're looking to do is to provide information and signposting. And we work very closely with lots of other patient groups like ReNU Syndrome United or whatever patient group exists for the particular condition. So we're offering that information and signposting, but also that community and emotional support that you heard from others that is so valuable. And we have a awareness day coming up on the 19th of June. Thank you very much.